Thank you very much, and welcome everybody to the seminar. We're very excited today to have a guest speaker who arrived last night from Istanbul in economy class, I might add. He tells me he has no jet lag. I don't know if I believe him. Kurtulus Aciksari, I apologize for pronouncing your name wrong. And he is actually the chairman of the emergency department in the Medeniyet University in Istanbul. He's also the director of the residency training program. So that's like 2 full-time jobs. It's a huge place, so it's absolutely amazing. He has a lot of experience. He previously was with the Ministry of Health and the Health Directorate in Istanbul in the Department of Disaster and Emergency Services. He's also doing a project with the European Commission entitled TEAMS, which is training for emergency medical teams and European medical corps. The professionalization of medical teams responding to disasters is a very hot topic right now. So this is a really key project. And he has experience of starting even as a medical student in 1999, responding to the Marmara earthquake, and then later in 2011 to the Van earthquakes. And he'll be talking to us today about that experience and some of the initiatives in Turkey in terms of putting some evidence base around what improves outcomes for these types of disaster management. So please give a very warm welcome to our guest from Istanbul.
Thank you very much. It's a long trip, but I'm not on jet lag. Be sure about that. Thank you very much for giving me that chance to explain what we did in one earthquake and what's going on in Turkey, in Istanbul, and in my area, in my region. Because it's very important. We are dealing with so many earthquakes, especially the Turkey is a very unique place. It's important. Today, we will speak about the one earthquake, but a little bit we can open a window to look at what's going on on Istanbul, like Istanbul, huge cities, big cities. Let me change it. Okay. Especially this talk will focus on the impact of a new approach. This new approach is a proactive model on the resilience of healthcare emergency response following the one earthquakes. This model is expected to reduce risk in major and vulnerable cities such as Istanbul. This is in press. This is a research, and now it's in press, and I will explain the details of that. Let me give you some important information about Turkey and disasters and Van Erciş earthquake, the methodology of our research, what we are going to do and what we try to do, the literatures and Turkish experience in mass casualty events like in Van, and the discussion. I need your opinions too in that discussion. And at the end, I will speak about national disaster response plans and emergency medicine systems, give some information about EMS and the disasters. How can they get together? How can we work them together? Because these are the parts, they have to work together all the time, 7 days, 24 hours a day. The first responders of all disasters, all the emergency workers. It's very important part for the future. Yes, you know that Turkey is a tectonically active country located across 326 faults with approximately 66% of its area laid on an active fault, subjective 70% of the population to high risk of earthquakes right now. And we had some experiences about the big earthquakes. In 1939, Erzincan, magnitude 7.9, 1999, Kocaeli, which I experienced too, 7.4, and those earthquakes, mortality rate is very high. 50,000 people, more than 50,000 people died at that earthquakes, unfortunately. And these are the big ones, especially in Izmit, in Düzce, and the fourth ones, the big ones in Turkey. We have to deal with them. Yes, especially in one earthquake, approximately 1,000 people, million people living here, and 1.4% of Turkish population, and half of the people living inside the cities. Especially like Turkey, the countries like Turkey, people migrate to the cities from the village areas. They want to look for the jobs. There are so many economical issues about that, and they like to live inside the cities. And it means that the city is becoming larger and larger, and crowded areas. In Van and Erciş, in 23rd October 2011, at 1341, 7.5 magnitude, and widespread damage, 604 fatalities, 2,608 injuries, unfortunately we had. And the second one is an aftershock, which is 5.6 magnitude, and unfortunately it was in one city, and some of the collapsed building, we lost 40 people that in Bayram Hotel. I will explain you about the details about the Bayram Hotel soon. And 4,000 buildings collapsed or severely damaged in my country. And the aftershock, 6,200, more than 6,200. And the aftershocks are very important for us because its impact is very widespread after the earthquakes, because if you didn't leave the people outside the cities, you have to deal with that. And the consequences, of course. At Bayram Hotel, this is Atsushi Miyazaki. He came to Istanbul. He was a doctor, medical doctor. He came to Istanbul from Istanbul to Van, from Japan, and he tried to make a medical rescue, but unfortunately, you see that outside the Bayram Hotel is very beautiful, but the building is not like that. After the second shock, it collapsed like that. The assessment is very important after the earthquakes, especially. The engineers looked outside the building, and the owner of the hotel said that my hotel is very new. I stronged it after the earthquake, but very soon it collapsed. And we lost so many people inside of it, 40 people, and most of them medical rescuers like him, unfortunately. Yes, we have good resources in Turkey. They are very rich. The country is rich, and we have 5,267 search and rescue personnel, rescue dogs, search dogs, and we have Mevlana houses, containers, prefabricated houses. We use them, but if you have more resources to give to the earthquake area, you have a very good plan. You need a very good plan, because everybody wants to go to the disaster area, and everybody wants to do something together, but you have to make it slowly, step by step. You have to know the details about that groups and the equipments, of course. In one earthquake, hospitals and school buildings performed better than in previous experience due to changes in their design requirements. There were 476 search and rescue teams who succeeded in saving the lives of 230 people buried under the rubble. This is very good. We are lucky about that. This is good because we are very lucky about that, because it's a very small area. We have to deal with very small population, and yes, we are successful about that. And let's see how we successful or not. There's a clip here. Let me explain you. Just a moment. It's about search and rescue. Does anybody hear me? especially the children, the victims of the all earthquakes. This part is very important for me because medical rescue teams and search and rescue teams working together inside there. And this is the first experience for us, especially in one earthquake. We experience search and rescue teams and medical rescue teams, how to work together. What are we dealing with that? What is the problems? What can we improve it? How can we improve that? We understand about that.
Bazı anlarda kameraları da kayıttaydı. Gönüllü sağlıkçılardan oluşuyordu ekipler. İşte 14 günlük Azra bebeğin enkazdan çıkarılışı ve bir sağlıkçının kucağında hayata dönüşü.
Hadi in. Yolu aç.
Eğer bir şey yoksa sedye daha zor olur.
Hayır,
şey
sevgili
yoksa-
sabitlersek bir şekilde biz verebiliriz.
Ha, tamam.
Yukarıda sağlam bir ekip geri çıkartacak.
Yukarıya çok bakmayın. Gözünüzde bir şeyler dökülmüş. Yukarı bakmayın.
Bulunması kadar depremzedenin enkazdan çıkarılma yöntemi de hayati öneme sahipti. İlk kontroller enkaz altında yapıldı.
Mermer bilinci açık mı? Kanama var mı? Buradan gelebilecek seviyede. Hocam boyalık verelim mi?
Var.
Doğru çıkmışlar bakalım onu.
Hastanın bilinci yerinde ama kıpırdayamıyor. Bacağında bir sorun var belli ki.
İsmail ayağını oynatma.
Speaking about the consciousness of the patient, speaking about how to take the patient outside safely.
Ama her ayrıntıyı da hesapladılar.
And they are trying to make the triage at that area, inside the crashed building.
Bayağı uzun maşallah sonra.
And they use life-saving measurements, LSIs, and interventions.
Bir erkek depremzede binanın enkazından yaralı kurtarıldı. Şu anda hastaneye kaldırılıyor.
They are carrying to the patient to the ambulance, and after the triage, it's going to the hospital.
Sesimi duyan var mı? İlk kurtarma ekibi.
Yes. That was a good experience for us. After the one earthquake, 200,000 people were forced to reside in 3,800 prefabricated Mevlana houses. Mevlana houses for the big families. More than 5 people can live inside that. 2,700 container houses and 14 tent cities we established. 40,000 who migrated to other regions due to anxiety, distress, lack of trust in the resilience of their buildings, of course. It's a very huge problem for the economy, of course. For many years, sorry. I'm sorry. Let me do it. Yes. Sorry about that. For many years, Turkey followed a reactive approach to the disasters. But after the 1999 earthquake, we want to change it. What the reactive approach is: fate, reaction, and recovery, wait and see, ex post. That means after the fact. Crisis management, ad hoc efforts, not planned before, and development at risk. We used to do this way. And in 1999 earthquake, we have to deal with that. We were not ready, unfortunately. Our buildings were not ready for the disasters. The municipalities were not ready for the disasters. Our industry and infrastructure, of course, they were not ready for the disasters. And our support units were not, they were inadequate and they were not ready for the disasters. We have to deal with that. And search and rescue teams, they didn't know how they do. They didn't know what is search and rescue means. Because of that, they couldn't save some lives, unfortunately. And there was a problem on the emergency medicine system, and they couldn't reach the disaster areas, unfortunately, in 1999. Hospitals were not ready for the disasters. Advanced medical posts, what does it mean? We didn't know that. What does advanced medical post means or in the disaster areas? And the main lessons learned for what we need: increase the resilience of telecommunication systems, landline and mobiles like that. Save capital through minimizing rescue losses. Improve organization and coordination in search and rescue. Reduce bureaucracy, enhancement of logistical support, and train and organize voluntary efforts, and integrate resilience in the development, building resilient infrastructure, public buildings, enforcing codes, improving inspection during the constructions. New approach that is driven by choice, proactivity, mitigation, anticipation, and prevention, ex ante, risk management, comprehensive approach, and sustainable development. Our methodology is, we went to the disaster areas after 2 months after the earthquake. We produced an international team from England, Italy, Japan, and Turkey for the field investigations between 10 and 15 December. And we collected the data both in the stricken area of Erciş, Van, and Istanbul, and involved unstructured interviews and a focus group. Methodology is SWOT. You know that the SWOT methodology: strengths, weakness, opportunities, and threats. Strengths, characteristic to have led or will potentially lead an advantageous position. Weaknesses, characterizes will potentially lead to disadvantageous positions. Opportunities, elements that could be exploited to enhance resilience. And threats, elements that could lead major failure. And requirements of search capacity. The provision of uninterrupted healthcare services is a matter of life and death. A healthcare service must have a suitable search capacity defined as a measurable representation of ability to manage a sudden influx of patients. It is dependent on a well-functioning incident management system and the variables of space, supplies, staff, and any spatial considerations like contaminated or contagious patients, for example. In practice, this has resulted in increasing healthcare resources following empirical approaches that are not based on evidence, thus have been viewed as obscure. The United States, for example, the United States National Preparedness Guidelines indicate that search capacity is one of 37 fundamental capabilities that the nation must implement in order to be ready to face a disaster. Like we go on the requirement of surge capacity. In reality, the problem of surge capacity is much more complex and includes at least 3 essential elements: continuous supplies, sufficient number of healthcare professionals, and infrastructure with appropriate medical equipment. And the successful healthcare response to mass casualty event depends on the effective coordination of the 3 major response phases: pre-hospital care, casualty distribution, and hospital care. Triage is usually used to dispatch patients to the most suitable healthcare providers with aim of efficiently allocate limited healthcare resources. And we learned some new things in the one earthquake about the triage. We will speak about later. On arrival at the hospital area, casualties receive a secondary triage, classify either critical, severe, or moderate. For this reason, it is important to organize a triage area outside the emergency department entrance to minimize the retriage procedures inside the emergency department. In one, an effective mass casualty management depends at least on effective coordination of the 3 response phases, competent triage staff with adequate resources and information, and management process that take into consideration vulnerable people. This is the first triage point in one. The first group made the triage point inside a sports center. It's a basketball line, but the building is not collapsed and it's safe. Inside of that, they built a first triage point. And reforming the approach of the resilience. The ability of a system, community, or society exposed to hazards to resist, absorb, accommodate to, and recover from the effect of hazards in a timely and efficient manner, including through the preservation and restoration of its essential basic structures and functions. And another important thing is resilience always needs to go beyond strengthening the infrastructures. We see that the holistic resilience concept, it's essential for healthcare service due to its complexity and intertwined components, and any damage to any of these components could result in a partial or total failure of the service. This is the injury, hospital, and treatments. These are the accessibilities and utilities and equipments. The important thing is if the treatments no, transfer to the other hospital, or yes, on admission or back home. It is very important for that. And these aspects could be finding ways to reduce the impact of other infrastructure failures, empowering people to interact more with other emergency agencies, and developing strategies to improve response to major hazards. The findings of this study, of our study, suggest that the Turkish authorities are implementing a more resilient approach due to the lessons gained from the previous experience. Many projects have been launched in Turkey to improve the structural capacity of infrastructure. Among these projects, 1,129 million pounds Istanbul Seismic Risk Mitigation and Emergency Preparedness Project, ISMEP project, its name is, started in 2006 and expected to end 2017. It's not ending in 2017, it's going more, because my new hospital is rebuilding with that project, and it's going to be finished in 2018. And there are 2 new projects about that. This project sought to strengthen the emergency capacity along with seismic risk mitigation for priority public buildings and enforcement of building codes. And we understood that the single approach for emergency response is very, very important. Especially, we produced the AFAD. AFAD's name is now Republic of Turkey Prime Ministry Disaster and Emergency Management Presidency, and the Ministry of Health Disaster and Emergency Coordination Center, which is name is SACOM, and National Medical Rescue Teams for medical rescues. And in the likelihood of the earthquake in Istanbul, and as a part of the ISMEP project, enormous resources have been allocated to building surge capacity. For example, in a daily, especially in Istanbul, in a daily basis, emergency departments in Istanbul treat an average of 1,000 patients, sometimes more than 1,000 patients. My residency hospital was two in Bakırköy and in Ok Meydanı in Istanbul. In Ok Meydanı, in a day, more than 2,200 patients come to my emergency department. Maybe we can speak about why is it, the reasons of that, for another interviews or another researches, but it's very big problem for the countries like Turkey and Istanbul, because everybody prefers to go to emergency departments for their every problems. Sometimes we are asking about them, why you are coming to the emergency department and you are just a flu. They are answering to us, I have to go to my job in the daytime. I may come to your department in nights, and it's very easy to find the solutions in emergency departments because we are working very hard and we are working with the solutions. They like that. People like that. The departments have a floor area of between 10,000 or 14,000 square meters, higher than the maximum values of proposed international guidelines. And fluid is going to be a big problem in the Istanbul, in the earthquake, but unfortunately all emergency departments are on the basement floor right now in Istanbul. It's going to be a big problem for the future. However, yes, it's under debate, it's written here. Some interviews view it critically to have the facilities within the city in order to shorten injuries, travel distances. Others saw this as challenging in terms of injuries, patient transfer, and continuity of supplies. Most of the government hospitals in Istanbul have all the emergency power generators, all the medical supplies and communication system at the bottom of the hospital, like I said before. Most hospitals in Istanbul are equipped with emergency generators, fuel tanks, 200 liters capacity, which is sufficient for approximately 4 hours. It means that after 4 hours, you are out of order. It has to be at least 5 days. And they are re-equipped the generators right now with ISMEP projects. They are giving new generators and fuel tanks. And there is another important thing for the Istanbulis. The airports, especially the Atatürk airport, is in the middle of the city right now. And in the earthquake, you couldn't use your airports. Maybe Sabiha Gökçen is useful in an Anatolian side, but unfortunately, it's a problem for the highways because it's a little bit far away from the city. Because we thought that all highways may be collapsed or closed, all bridges may be closed. End of the speech I will show you, and unfortunately, we couldn't use the harbors. In rush hour, with the traffic problems, you can't use those motorways, of course. It would also be difficult to receive external assistance within the first 24 or 48 hours. It is the reality. You have to deal with the disasters by your own capacity. Fire department, emergency medicine system workers, especially working in the ambulances, and emergency departments, and trauma centers. We have to work with them. We don't have closer cities to support us. Istanbul is not a city if you look at how far it is from its neighbor cities, resulting in it being viewed as a small country. More than 15 million living inside Istanbul. With current surge capacity in Istanbul relies on healthcare infrastructures located in the disaster area in Erciş and Van. It relied on facilities located outside the disaster zones. And it is not the solution for big places like Istanbul or highly dense cities. The approach adopted in Van was easy to use in this region because the population is not high and the number of the injured people was small. In Istanbul, you cannot do that. Yes, you see, transporting all patients to hospitals outside the disaster area was feasible during Van earthquakes because of the substantial resources allocated and the relatively low volume of population and recent mobile communication system improvements. And we can use military helicopters, Ministry of Health helicopters, and all ambulances. The roads were open, and we can dispatch the patients in the night, especially on the one leg, and easy with the Skorskis. It is very easy to carry the patients with the Skorskis, with the military. Site information. Initially, medical rescue was secured by local medical teams before the arrival of organizations such as national medical rescue teams, a few hours after the main shock. The initial challenge faced by the rescue teams was the estimation of the amount of available resources, medical resource, rescue teams, ambulances, equipments, and managing them based on the limited available information. It was difficult to find maps of the area. When we reached the area, we are all blind. Where are we? Where is Erciş? Where is Van? Which buildings were collapsed? We didn't know anything. And we have to discover it by ourselves, step by step. And we are lucky because not big area. Yes, when we heard the earthquake in the night, in the day, and in the night we were at the Atatürk airport, and we were ready to go, but we have to wait at least 6 or 8 hours inside the airport, because Turkish Airlines told us that you don't have any negotiations, you don't have any protocols with us to go to that area. Only the search and rescue teams may go, medical rescue teams have to wait. Of course, it's nonsense. Because of that, I told you before, this is the first time for the Turkish search and rescue teams and medical rescue teams work together, because they didn't understand the medical rescue. What does it mean? We learned that, especially in one earthquake. Medical rescue is very important. And after that, 66 medical rescue personnels. In Erciş, 1 o'clock in the day after, 1 o'clock a.m., we were in Erciş. This is the sport complex. We found it. Here it is. We choose this place because it's outside the city. I will show you on the map. And it is a very huge area for car parking, for the ambulances to work. It is easy. And you see that everybody goes to one. Step by step. We have huge capacity for support, but everybody goes to one. Yes. What we found, 55 buildings found collapsed in Erciş. Every damaged building searched by SNR teams. You see that? We will speak about the reasons of why they collapsed soon. Medical rescue teams and SNR teams, SAR teams, located in each damaged building, like you saw before. And here is the map. Let me show you. These are the disaster areas. And these stars are the collapsed buildings around there, showing. We are lucky about that. This is the main road. This road is going to Van. This is the highway. And the buildings around there. Here it is. There is an Erciş State Hospital here, which is that one. And the public health has a family medicine, family practitioners building right there. We are lucky about that. It is new building. It was new building, and we worked at there after the earthquake. But we couldn't use the Erciş State Hospital. We only use it for the disaster victims identification. We use it for the deceased people, unfortunately. And we carried all the patients to the, like here, mobile field hospital, very close to that basketball area. And I will show you later, it's behind there, there's a stadium, a football stadium. We can easily use a tent city. We produced inside a tent city. And this is the field hospital we can use. This is the first time, and after that, the other side of the building. We created the field hospitals around here. And We transported all the patients outside the cities, like Van, Bitlis, Diyarbakır, Malatya, Erzurum, Ankara. This road is between Bitlis and Van, highway road. Yes, here is the field hospital. You see that the area is empty, and there's a stadium with the tents. After that, we produced a field hospital here, right there. Coordination and collaboration. All 604 casualties caused by the 23rd October shock were transported to the hospitals outside the disaster area. On 13 November, 102 patients, 36 of them in critical condition, were transferred by planes to hospitals located in cities far away from the disaster area, such as Ankara. But we had a real problem of coordination because we didn't have enough people with experience in earthquakes. We have so many people, but very less experienced people in earthquake and disaster management, and the coordinators are arriving from other cities, and all the time coordinators changed weekly. And these are the interviews I will explain to you. They didn't know what to do. There was nobody taking control and making decisions. This was a big problem, that of coordination. And the other one said, now we have more professional teams, more mobile equipment, more vehicles, which is a good development sign for our country. However, effectiveness is still to be targeted. By using less human resources and working in a much more coordinated manner, we should have done more effective rescues. We worked well with other teams, but we had problems with coordination and logistics. We worked well with our team, but not with other national medical rescue teams. Some of the interviewers say that. The crisis center creating contingency plans with rehearsals and simulations, but there are individual procedures which are not communicated to other agencies. We are conducting our own contingency plans in our hospitals, as is the National Medical Rescue Team, the fire department, the police department, and there is no sharing of strategies. These are the interviews. The constant change in coordination meant a constant lack of clarity combined with absence of leadership and collaboration between teams led to less effective use of resource and difficult environment for emergency operations. Triage. Triage is a very important thing for the disasters. Ambulatory, we triage the people ambulatory, delayed, immediate, and decased. Everybody knows what the triage is, but they don't use it, the interviewers say that, especially in the disaster areas. Patients were transferred from impact zone to the advanced medical post, like I showed you before, the field hospital. We created it like an advanced medical post. These acted as triage and stabilization points for patients before transporting them to the most appropriate hospitals. Yes, this is the event. We use it. The event. First of all traumatized patients goes to the advanced medical post, like field hospital. And we use the public health building for the patients who goes for their normal illnesses without disasters. They go for flu, they go for the other reasons, they use that building. And we make, for example, self-evacuated patients goes to the advanced medical post by themselves, or if they can't, we carried decased, immediate, delayed, and ambulatory for the triage. And the ambulatory, if there is no treatment on the field, further ED or secondary triage in front of the emergency department, like field hospital, in the field hospital, and we discharge them if they need any help or not. And especially for the major treatment areas on observational units, we don't use intensive care units inside the Erciş especially. We send them to the hospitals around the cities like Ankara, like Van, like other cities, close cities. And sometimes they use their station in the disaster area, and they become successful. They became successful. Some of the stations became successful about that. but it doesn't mean that we are successful about everything. Yes, care in the recovery phase. Many of the healthcare staff who remained in the area were traumatized and refused to enter the healthcare facilities, of course. They are operating theaters and intensive care units here, but they didn't want to use them. It was regrettable to transport patients who could easily be treated in their current location out of the area. All medical functions, apart from emergency services, were provided in tents located in the parking area in spite of weather condition and the good state of the hospital building. Let me show you the hospital building, especially in one. They explained that because of in one, before the earthquake, maybe 3 or 4 months, opened one research and training hospital, and it's a very new hospital. Do you think that one regional training hospital staff members were unable to perform their duties? They are afraid of the earthquake. They don't want to work inside of that. Do you think any reasons about that, just for the afraid, or is there any problems about the interior architecture? Do you have an opinion about that? We had a problem about that because you see that the ceiling, the up, you see this place. Unfortunately, with the shake of the earthquakes, the ceiling dropped into the people, and everybody afraid of that. The building is very good to use for everything and ready to use for everything, but unfortunately, the people inside of that, afraid of that, the ceiling dropped and they goes out. They thought that the building going to be collapsed. It is very important for risk assessment and using the infrastructure. The outside, it has very huge surge capacity here. We can easily use it in one. That was a good experience for me. And medical rescue teams, especially the volunteers, you should be very careful about them because they are the volunteers and they are right there for working with you. They are right there for being with you. And some of the interviews say that the work is very hard and we are very tired. Work and health conditions by providing better resting areas for rescue teams. You have to look at them. Their food, after, for example, 3 days or 5 days, you have to find them a place, for good place. They can produce their tents. Otherwise, they can go inside the hotels like that, and after the aftershock, the hotel collapsed. This is very important rule. If you go to a disaster area, you have to stay in the tent. Don't go out. Don't go inside the building. It's the first note. Yes, in the second earthquake of one, you see that the greens and yellows, the green ones collapsed in the first building, first earthquake. The yellow ones collapsed in second earthquake. Especially this is the one. I take that picture from the military. Yes. And it's interesting. They are getting together, closer area. Collapsed building concentrated in an area. Construction year of collapsed building was close or not? It's a question for me. And after 2009, new buildings established around that area, and they used the sand from the one lake. What does it mean? It means that you see the damage on the column. Here it is. Like that. The bars and the cement is not getting together rightly. Let me explain. The round bar was used in old buildings, some of the round bars. Concrete, the cement, and sand. Sand in one lake was used, unfortunately, for the new buildings. And inappropriate construction material and technique we found for the new buildings. Because of that, they are getting together because that area was new. They all collapsed. Yes, you see the damage of the wall? X signs, it means that shake like that. You can't use that building again. And these ones? These are the hospitals, some of them. This is pediatric for the children hospital, unfortunately. It's not collapsed, but unfortunately damage very high. Thanks for the Professor Misakatsu Miyajima for that. And discussion. What are our strengths, weaknesses, opportunities, and the threats? Our strength, strong and renewed healthcare infrastructure we have. Bed capacities are more than before. Evacuation and triage space we have. Highly competent human resources, yes we have. Substantial transportation resources. Triage protocols and processes. Political involvement. Resilience, promotion, and involvement of army, yes we have. And we have opportunities. Development of a comprehensive emergency model. More effective and efficient working environment. What are the weaknesses? No side and resources information. No clear processes to deal with vulnerable people, especially chronically ill staff with PTSD. Lack of restoration processes. Management procedures, coordination and collaboration. The huge problem is coordination and collaboration. We have to produce the leaders. We have to teach the leaders. The leaders are very important, especially in disasters like that. And threats. Inadequate risk assessment and failure to adopt a multi-hazards approach. Change in government priorities and direction. Don't worry about that. Resistance of agencies and collaborate and cooperate with each other. Occurrence of a major hazard before an acceptable preparedness level is achieved. And improvements to organization and coordination. The findings suggest that the effectiveness of this model depends on the ability to collect information from sites immediately after a disaster, enhance of the effective use of resources, ability of healthcare staff members to perform their critical role in the rescue chain, addressing the need of healthcare and rescue teams, enhancing the communication between the teams and agencies pre- and post-disasters. Conclusion, the findings suggest that the approach succeeded in developing a single vision by consolidation official efforts in a more structured way, like AFAT, mobilizing many governmental and non-governmental organizations, armies and volunteering teams, securing significant amounts of resources, including physical and human, and ensuring that infrastructure is resilient and sufficiently flexible to expand its capacity. And more attention is required to the development of stronger management procedures. For example, coordination, interagencies collaboration, vulnerable people, restoration process, and faster building safety evaluation. And enhancement of current resources, like site information. I show you. Oops, sorry. Okay. And let me explain you about the future project. I mean future project, but it's already working right now, the TAMP, Turkey National Disaster Response Plan.
Turkey's National Disaster Response Plan, a new approach to disaster and emergency response.
Sorry, it's not working here. Just a moment. Excuse me about that. Yes.
Turkey's National Disaster Response Plan, a new approach in disaster and emergency response. Now we are more prepared for disasters and emergencies. TAMP includes public institutions, the private sector, non-governmental organizations, and real people that would have a role in an effective response in the wake of disasters and emergencies of all kinds. TAMP, Turkey's National Disaster Response Plan. A new approach in disaster and emergency response. Now we are more prepared for disasters and emergencies.
TAMP includes public institutions, the private sector, non-governmental organizations, and real people that would have a role in an effective response in the wake of disasters and emergencies of all types and scales. It features a modularly structured system created with an integrated planning approach to minimize operational risks during a disaster response. The major associates working in coordination with the Prime Ministry Disaster and Emergency Management Presidency in TAMP, with interoperability at the forefront, are, at the national level, the Ministries of Internal Affairs, Transport, Maritime Affairs and Communications, Health, Energy and National Resources, Environment and Urban Planning, Family and Social Policies, Food, Agriculture and Livestock, and Finance, as well as the Turkish Red Crescent. At the local level, in the provinces under the Provincial Disaster Response Plan, it is the local agencies of the same institutions within the coordination of the provincial disaster and emergency agencies under governorship. With TAMP, the answers of who will do what during any disaster and within which response organization have already been determined. There are a total of 28 service groups created according to the nature of the services provided during the response. TAMP defines the roles, duties and responsibilities of every service group and coordination unit taking part in disaster and emergency situations, such as earthquakes, floods, landslides, avalanches, fires, industrial accidents and mass influx, taking into account their field of expertise, and determines the basic principles of the response plan in all three phases, before, during and after a disaster. The IT background of TAMP is the Disaster Management and Decision Support System, or IDES. It is a web-based information system where all authorized institutions can manage their resources, and so it enables faster coordination through joint decision support mechanisms via its communication network. One of the factors that support TAMP is the 22 logistic warehouses or centers built all around Turkey to transport temporary housing and shelter equipment to the disaster zone in a timely manner. A truck can be dispatched from a warehouse in a matter of minutes, and the equipment can be tracked and controlled remotely. Training and tabletop exercises are held at all levels all over Turkey on a regular basis to ensure the operability of the system and to increase public awareness. For all types of disasters and emergencies, the fast, effective and comprehensive response organization provided by Turkey's National Disaster Response Plan will save more lives in a shorter time over a wider area, carry out responses in a faster manner with an effective use of resources, minimize social and economic losses, return people's interrupted lives to normal as soon as possible. Turkey is now more prepared for disaster and emergency situations with the National Disaster Response Plan.
No one can kill us. Yes. Let me show you this one. Here is Istanbul. More than 50 million people living in the city. The city living 24 hours a day. A moment is very important. After the earthquake, all the internet, all electricity was gone. There is no TAMP, National Medical Rescue Plans. There is no other plans. You have your own, your hospital disaster plans and cities plans, very important. We thought about that. First of all, emergency medicine teams must be affiliated, work together, especially in the simulations and practices. And now we divided the cities 1, 2, 3, 4, 5, 6 parts. And maybe we can manage the disasters inside of that parts soon. We can speak about that later. Thank you very much for your attention.
Thank you very much for sharing this amazing knowledge and hitting on a number of points, including some of the response teams, the triage, the building codes, the human factors I think are very important. People being afraid to go to work even though the buildings are safe. Why don't we open it up for a few questions? Yes, please.
Please introduce yourself.
My question is regarding refugee crisis, and I
let me show you a map about that. Just a moment. The first Turkish map showed that. Here it is. You see that Turkey is a very huge country. And the problem is, at that area, very close to the Syria and Iraq, you see that? We produced 10 cities. I mean, the 10th city can take, maybe you imagine, 200 tents, 300 tents. No, thousands of tent cities. Thousands of container cities. They produced inside that areas. And inside the tent cities, we have some emergency departments, we have some family practitioners working together, children hospital inside that working together. Think about that. This is a real city. Huge people living inside that places. And unfortunately, there are more coming to Turkey. We thought about that. And some of them are the close families with that area. Some of them living with their families together because they have parents inside of that area. Because before the war, they were together, they were the parents, or they know each other. They are living in some of the Turkish citizens' houses. And now, unfortunately, we can't stop them here. They are in Istanbul, they are in Izmir, they are in Adana, they are everywhere in Turkey. They are now becoming a citizen of us. But most of them living around that area. It's really a huge problem. The billions of dollars we paid for them, and we couldn't stop it. We have to help them because they have nowhere else to go. There is no place, because if they go that places, only war. Iran, they don't want to take it. They take some of them, but not much more of them. Only area they have to go is here, and we have to help them. We don't have any choice. We have to stop them inside the country, and we understood what the refugee is right now for last 6 or 7 years. And for example, in my born city is here, and my family saw the Syrian refugees and Iraqi refugees, and they are now working inside the industry right now. They are working with our people. Some of them opening the shopping places inside the city, and we are getting familiar with them, with their cultures right now. Not an assimilation. They are using their cultures inside the cities right now. They are becoming a part of us for the future. Yes.
I wonder, since we're talking public health, if you could comment on the public health issue of measles in the refugee camps. You may not know, but we actually had a small outbreak of measles in Orange County, probably starting at Disneyland with some unvaccinated travelers, but much smaller than the threat in a refugee camp.
Yes. Yes.
You want to talk about the measles?
Yes, unfortunately, we had the problem the same as it in Turkey too, and we need to close them. How can I explain? Sorry about my English about that.
Better than my Turkish.
Thank you very much. Thank you very much. We have to we close to contaminate them, and the problem in measles is especially in Istanbul side. We are looking for the new measles cases, especially more than 30 years old people and the adults in new. But now we try to manage it for the contamination and the vaccination again.
The issue with measles is if the population is not vaccinated, so they're susceptible, right? If they're not vaccinated, it's highly contagious, like about 90% transmission, as you probably know. So in refugee camps, one of the first things that needs to be done is mass vaccinations. Otherwise, you can get measles outbreaks, and also giving vitamin A, because
Yeah.
otherwise you can have very high mortality from measles. So it's not just traumatic injuries and psychosocial issues, but there's also other public health threats, and measles in particular is a huge issue in the refugee camps.
Yes.
Other questions? I think I saw one over here. Anybody else? Do you have any other comments?
Thank you very much.
Okay, thank you all very much for attending.
Thank you very much.